Hello, I'm the Revd Gail Hunt from the Methodist Church in Sheffield, and I want to encourage you to get your vaccination. Before I was a minister, I was a senior nursing sister in a busy GP surgery, and I've given thousands of vaccinations in my time. And I know what strict testing and standards every vaccine has to meet. And the Covid-19 vaccine has gone through no less a vigorous process. I have confidence in the information that scientists have given because it's built on years of experience which I have personally trusted in. It is much safer for your body to build up its immunity through vaccination rather than catching this awful virus. It's only natural, of course, that you ask questions and you look for reassurance. And that's why, as faith leaders, we want to offer in this video support, reassurance and correct information. I was a nurse practitioner when misinformation was given about the MMR vaccine, and I saw for myself what damage this did. At the heart of all faiths is a desire to love God and one another. So please keep yourself and others safe by taking this vaccination. It's our chance to help save lives. I'll be having mine tomorrow, and I am so thankful.
Hi, I'm Darryl from Tapton Hill Congregational Church. I also volunteer at a vaccine centre, and I'd just like to share with you a few thoughts. One is that it's been great at the centre. There's been absolutely no problems while I've been on my shifts. People have come in, even if they've been a bit nervous, they've come in, they've had the vaccination and they've left, and usually with a smile on their face. So nothing to be worried about, all good. And in fact, after one shift, I had my vaccination and I felt fine. I felt really, I'd done something that was good because it means I can now spend more time with my mum and sit and have a cup of tea with her in her kitchen, in her bubble.
I'm the senior pastor of City Life International Church, and we are here today just to talk about the vaccine. We have a few members of our church who are going to be talking about their testimony and their experience.
I'm a support worker for Sheffield City Council. I work for the short-term intervention team, which we deal with people that's been into hospital. So as a carer and as a woman of 57 years, it was important that I had the vaccine. So I didn't have any problems at all having the vaccine. I had it last month and it was very well organised, very well run, the place where I had it. And I didn't have any side effects, I didn't have a sore arm. Maybe the only thing I had was felt a bit tired after it for a few days, but that soon passed. And I felt fine.
I'm Subhash. I work as a physiotherapist in one of the community teams. I had my vaccine just before Christmas. I work with elderly people, vulnerable people, and it was important for me to take the vaccine as well. So I had my vaccine just before Christmas and I felt fine. I had no side effects whatsoever, and my arm ached, which is quite normal after an injection. But other than that, I was absolutely fine, and it gives me great courage now to work with people who got COVID. That is not going to affect me.
I am 70 years of age, a retired construction manager, and I've had a really good experience of receiving the Pfizer vaccination. I was fortunate in able to go to my local doctors, and they were just marvellous. Everything was on the ball, everything was set out perfectly. And when I had the vaccination, we had a little room to sit in and wait in just to make sure we didn't have any side effects. And I spoke to my doctor recently and he told me that they've had no side effects with any of the patients at all. So I would recommend anyone who's not taken the opportunity to receive the vaccine that they contact the National Health Service or their doctor. Take it immediately. It might save your life.
My name is Kishore. I work as a pharmacy manager. I had my vaccine a month back. Before I had my vaccine, a lot of rumors I heard about their side effects and everything. But as a frontline worker, I went and had my vaccine. I had a Pfizer vaccine, but I never had any problem at all. The only thing is, like, just for a day, my hand ached. Apart from that, I don't have any side effects at all. It gave me confidence to go and talk to the patients, because I come in contact with many different ages of people. I really recommend everyone, to whoever have the opportunity at the moment, to have a vaccine. Thank you.
My name is Terence. I work for Derbyshire County Council as a teaching assistant with in a special needs school. So basically we're at the front line with working with children, or also parents who are actually on the front line as well. Guess what? I get my vaccine this afternoon. So I'm looking forward to it, actually. It's going to be okay. I don't mind. I think it's something that everybody needs to do. And so, yeah, mine's this afternoon, so
Brilliant.
Look forward to it.
Thank you very much. So we've seen that the testimonies have been great, the vaccine has been very simple to take, and so we encourage everybody to take the vaccine. Thanks very much. Bye.
Good morning. I'm Bishop Tim. I'm an Anglican bishop here, living here in the city of Sheffield. And last night I went for my Covid vaccination, and I just wanted to tell you a little bit about it. It was at the Sheffield Arena, entirely painless process. They were very kind, the staff. They answered all my questions when I asked them, and the jab itself was literally painless. A slight scratch, if anything, at all. So, and I had no ill effects this morning either. So I do encourage you to take the vaccination if you are offered it. I'm old enough now to remember the days of the 1950s when we had mass inoculation for things like polio and diphtheria. And of course, as a result of that, those diseases are practically eradicated in the country today. And COVID is the new mass inoculation and will be just as successful. And I also want to encourage you to trust the scientists who produce this vaccine or these vaccines. Because if they tell us that there are no animal products used in the production of the vaccine, then they are to be believed and trusted. If they tell us there's no human cells being used, then they are to be trusted. And if, of course, they tell us that there is no IT company interference in the vaccine, then again, above all, they are to be trusted. So trust the scientists who produced the vaccine. So at the end of the day, for me, having the vaccine is an act of love for yourself and for those around you, because there's increasing evidence that the vaccine also lowers the transmissibility of the COVID infection too. So you're protecting those you love, your friends, your family around you. So keep well, keep safe, follow the government guidelines, but above all, if you're offered the jab, please do have it.
Hi, my name's Malcolm and I'm the Archdeacon of Sheffield and Rotherham in the Anglican Diocese of Sheffield. I'm just going to say a little bit about my experience of having the coronavirus vaccine. I received a text message out of the blue from my GP surgery on the 16th of February inviting me to book my vaccination, and without thinking I responded straight away. I booked in for the following day. And only then did I begin to wonder why it was that I might have been invited so soon. But I guess I've always worked on that basis that when you're invited to have the vaccination, go. Why wouldn't you? After all, this is to give you and those you love, those that you spend your time with, increased protection against the virus that has turned all of our lives upside down over the last year and has sadly led to so many untimely deaths. Why wouldn't you jump at the opportunity to get vaccinated? So I did, and the next day I went. The process was incredibly well administered at my GP surgery. I didn't have to wait for long, and the short queue was managed well by stewards to ensure COVID safety. The actual jab was completely painless and over in seconds. In fact, it was even less invasive than the annual flu jab that I also have, and I speak as somebody who really doesn't like needles. I had the Pfizer vaccination, and so I had to sit for about 15 minutes afterwards to be monitored once I'd received the jab. And then I walked home, and that was that. Even though my arm felt a little bit sore the following day, it was honestly nothing that should put anyone off. And I'll certainly be going back for my second dose when I'm called.
Hello, my name is Phyliss. I'm a Christian and I worship at the church on the corner. I work as a staff nurse at the front line, and I've been vaccinated against COVID-19. I encourage everyone to have one when it's their turn, since the vaccine has gone through the standard procedure and has passed all the safety measures. I encourage everyone to have it. Thank you.
Oh, hello everyone. My name is James and I'm a registered nurse working in NHS, and I work in a specialist respiratory ward, and we have so many COVID patients in our hospital. So I had both of my COVID vaccinations, which were quite safe and protected. So I will advise everybody, every Christian and all faiths to take it. It's a safe, there is no alcohol, there is no meat products in there, and there is no other harm, and there are not much side effects. So I will advise everybody to have it and keep everybody safe and keep yourself safe as well. Thank you very much. You can see my card. I had both doses. Thank you.
My name is the Reverend Sallie Wilson, and I'm the minister of Church on the Corner, Pentecostal Church in the north of Sheffield. And you know, over the last 10 months we've been praying as a church and as an individual for an end to the pandemic and a way out of this terrible, terrible virus. And we believe as a Christian community that God has provided the answer to those prayers by providing us with a vaccination programme that can keep people safe from the coronavirus. And so as a minister of the Word of God, I want to urge people, I want to urge everybody out there that when your time comes, take the vaccine. You know, the vaccine has been proven to be safe. It's a vaccine that contains no alcohol in it, contains no more alcohol than you get in a banana. It contains no meat produce in it. It's gone through all the safety testings that every other vaccine goes through. You know, there's many Christians out there that think that it changes your DNA or that there's other elements to it. Please, it's not true. The vaccine is safe. And the vaccine is what will bring us out of this pandemic and what will save lives. So as a Christian community, it's our duty to look out for each other. It's our duty to love our neighbour as ourselves. And one of the ways that we can do that is by taking the vaccine and keeping each other safe. So please, take the vaccine. When my turn comes, I will be going out there to the vaccination centre and I will be getting my jab. Please, everyone, do the same thing.
The COVID-19 and ethnic minority group highlighted in the COVID-19 cases among the key workers. Although Black and Asian staff represent only 21% of the NHS workforce, early analysis showed that they accounted for 63% of death among health and social care workers. This picture has also been reflected internationally. In US, the case and admission rate are at least 2.5 to 4.5 times higher, respectively, among Black, Hispanic, and Native American population, American with white population. There is a lot of disparity cause of ethnic community. The factors are racism, structural institutional racism, cultural racism, discrimination, social detriments of the health, and socio-economic status. As they are living in the urban areas, poor and overcrowded housing, high-risk occupation, higher burden of comorbidities, example, cardiovascular disease, diabetes, asthma, and the cultural barriers. In UK government reports on ethnic disparity of COVID-19 states that some of the access risks remain unexplained, despite accounting for socio-economic and geographical factors such as occupational exposure, population density, household composition, and pre-existing health condition. According to the Royal College of GP, white people in England are more than twice as likely to have been vaccinated as people from the black background, and 3 times likely as people from the mixed ethnic background. There has been some false informations rumored in public. SAGE has warned that distrust about COVID-19 vaccine is linked to the spread of misinformation as well as the speed of the jab that was approved for use. Several fears based on myth about the vaccine among African community in UK. They include that people were being used as experimental animals and that the vaccine will change their DNA. Another fear expressed was that the vaccine will insert a microchip that will activate the computer. Some myths are very, very baseless, but they believe that the human beings are being used as guinea pigs. Fear being targeted among the people in the media, in the Muslim community, that somehow the vaccine contains components that are halal. England's Deputy Medical Officer, Professor Jonathan Van Tam, has also dismissed the false conspiracy theory that the vaccine increased fertility, describing it as a nasty, pernicious, scary story. Government in NHS have launched a new vaccine uptake plan that is designed to reach vaccination and underserved groups and dispel the myth that's surrounding the COVID-19 jabs. Among its new initiative, several public health videos have been translated into 13 different languages to target specific audiences. Celebrities and the cross-party group of MP have also collaborated on social media video to encourage the uptake. Meanwhile, Home Secretary Vithal Patel has told media companies such as Facebook, Twitter, and YouTube that they have social responsibility to take the anti-vaccination content and wider misinformation about the coronavirus pandemic. During a visit to the vaccination center in North London, she said, "I would say to social media companies, do your own bit. Take responsibility, pull down misinformation and disinformation, and there is no harm in actually taking a lot of their stuff to the NHS and government UK."
Right, I'm Roy Travis, a member of Church on the Corner, born again Christian, and I've had my vaccine, and it's absolutely perfect. No side effects or anything. It's truly good.
And I'm Margaret Travis, and I'm a member of Church on the Corner, and I had mine 3 weeks back, and everything was fine.
Hello. My name is Pete Wilcox and I'm the Bishop of Sheffield, which means that I'm responsible for overseeing the mission of the Church of England across South Yorkshire. I'm recording this short message because I believe it is important for every citizen to get the coronavirus vaccination as soon as they are offered it. I'm waiting eagerly for my invitation, and I will definitely be taking up the opportunity when it comes. There are two reasons why I'm going to do that, and why I believe it is the right thing for everyone to do. The first reason is not actually about me, but about my contribution to wider society, to my community, my family and my friends. You see, once I am vaccinated, it is significantly less likely that I will catch the virus, and that means it'll be significantly less likely that I can pass on the virus to anybody else. It also means it will significantly reduce the risk that I will need hospital treatment, so my vaccination will reduce the pressure on the NHS, meaning that they can focus on those who really need intensive care. But secondly, of course, I will be grateful to take it simply so that I will be better protected against the virus myself. I'm fit and healthy and not particularly vulnerable, so I have been happy to wait for others, and especially for older people, to be vaccinated first. But when my turn comes, I will be thankful, because the vaccination will be part of the way in which I can feel safe over the course of the coming months to resume the sort of close contact with other people that I have been missing so much during the pandemic. So please let me encourage you, for your own sake, for the sake of your family and friends, for the sake of your community, wider society and the NHS. When the opportunity comes, please take the vaccine, and may God bless you.
I'm here just to have my vaccine. Surprisingly, this is the nurse here, and we've had no trouble whatsoever, so I encourage everybody to take their vaccine. Bless you all. Bye.